Super Bowl Sunday, I rolled over in bed, and the world started spinning again. What'd you think of that? Allan, Karl, WorldRider checking in here. Some very, interesting news, I guess. A little bit of disturbing news, but not in such a bad way. But bottom line is, if you've followed me for these years, you know back in 2020 I had a bout with vertigo. And over a lot of months and practically a year or more of therapy, vestibular therapy, I seem to have not let it bother me anymore. Well, Sunday morning as I got up, Super Bowl Sunday, and rolled over in bed to grab my phone, it came back. Back again. Vertigo. It was pretty strange. At least this time I knew what was going on. Not like bad like last time. Don't think it was triggered by a virus. I think this is classic BPPV vertigo. So I went through the motions and put myself through what they call the Epley maneuver. For those of you who've had vertigo, you probably are familiar with that. But it's just a way to kind of resettle the crystals that establish balance in our brains and in our bodies back to their home. And what happens in vertigo, in BPPV vertigo, is those things escape, and that causes the dizziness and the spinning. So anyway, I have Dr. Purcell down in San Diego, is known as the Dizzy Doctor, and he's the guy that has the motorcycle in the waiting room when you get to his office. He's the guy that's got my book Forks sitting right next to that motorcycle. And I'm gonna see if it's still there, because it's been years. It's been since 21 that I have been down there. But anyway, I had his number, he'd given me his personal cell phone number, and he says, text me anytime if you want to come in and take a ride on the Epley Omniax chair. And there's a video here. I'll point to it up here. You go check that out. You'll know what I'm doing. I'm going to go get in that chair now. I texted him last night, and I didn't hear from him until about 20 minutes ago. But I did call his office first thing in the morning, and they said, we can't really get you in. Maybe Monday, but right now we're normally back 4 to 5 weeks. And I'm like, oh no. Because this thing it's not good. It's not good. Definitely not good. Anyway, I'm going to see Dr. Purcell. I'm going to get in the Epley Omniax chair. Hopefully, put this thing to bed. I'm not sure what triggered it. I'll certainly have that conversation. It happened Super Bowl Sunday, and then it happened yesterday, which was Thursday, 4 days later, and it happened again this morning. That's the news. I'll report. I'll continue this video documentation of my bout with vertigo. Oh yeah, one more thing. I'm stopping here in Cardiff because when I talked to Dr. Purcell, he said they're gonna hate him up there at the front because he just says, tell him I said you can come in. Anyway, so he said, and I said, well, I'll kill him with kindness. He says, well, bring him some candy or something. So I'm right over here at VG Donuts. I'm gonna bring him donuts and say it's Healthy Friday for this. Let's go.
Old-fashioned, is that okay?
That's okay. I got my donuts. Let's go see Dr. Purcell. Okay, we're here, right here by Mesa College. I always forget where this place is. I got donuts. Let's go see Dr. Purcell. Let's make some staff happy. Let's see. Yes! There it is, the old Triumph motorcycle. And wow, check it out. My book is still here after all these years. Okay, let's go ride the chair.
Okay, so just watch your step, have a seat here.
Yes, deja vu.
Yeah, it's been a while.
What's your name?
Hi.
Kai?
Yes.
Okay, Allan, as you
Nice to
know.
meet you. So I know it's been a while, but what we're going to be doing essentially laying you in those positions again, but also since it's been about half a decade now, it's rotations about. We're just also going to do a little bit of essentially calibration on your eyes, kind of watch how your eyes react when we rotate you around left and right. And then we'll get into those positions right after, okay?
Sounds like a deal.
And after that, I'll dock over, and then we'll come and talk to you, and we'll do the rest of the appointment afterwards, okay?
Sounds great. Thank you.
Yeah. Those goggles again here, if you don't mind just holding them to your eyes.
No.
I'm gonna just adjust the straps over everything right here. Okay. And then just gonna move them down just so I can center them.
Okay.
All right. And then a headrest coming behind you here. This is just again for you to lean back on while we're in those 90-degree positions, okay? And eye cover going on you here.
Yep.
Keep your eyes open for me, just like that. I'm just going to make sure that cameras are all adjusted to you. I'm going to adjust the focus here. Okay, should be good.
Are they moving at all?
Not just yet.
Okay.
All right, so we're going to start off with those rotations like I mentioned.
Yep.
Starting with a spin to the right. Keep your eyes wide open.
This is for the calibration, right?
Sorry? Yeah, essentially. We're going in 3, 2, 1. Eyes wide open. Close your eyes. We're going to sit you back up. We're all done with testing here.
Okay.
Just going to go over a bit of that footage to make sure I didn't miss anything. Doesn't look like you had anything too much right now, but
I did do myself the Epley on.
Epley's could be part of the reason here.
What, that I did it? Or?
Yeah, I mean, how recent was that?
This morning.
Okay, yeah, that could have been the case.
I did, what happened is...
Did you do it on your right or left side, can I ask?
So I did it on my... so when I rolled over in bed this morning to the right, on like the right side, then that's when the dizziness, the spinning goes. So when I did the maneuver, I lied on my back and I started in the position, moving my head to the right, then to the left, and onto my right shoulder. But yeah, so I did it. So the final position would be me on my right shoulder looking down at the floor.
Gotcha. Okay.
I don't know what that's, does that make sense to you?
No, it does make sense to me. Because if anything, I'm seeing it a little more on the left, so.
Interesting, okay.
But it's still kind of mild, if I would say, but maybe Doc wants to do a retest. I'll let him know.
Okay.
Doc, I'm ready for you at the chair. I have a soft call AS positive. Patient's asymptomatic throughout. Doc?
BPPV, so let's go ahead and treat aggressively on that with 4 maneuvers and then retest.
AS positive.
How
you doing, sir?
Doing well, how are you, man?
Well, thanks. My name's Evan. I'm one of the PAs.
Evan, I'm Allan.
Nice to meet you, Allan.
Soft call on it, but it's probably mildly symptomatic, you said. Bit of a right beat on AD.
Yeah. I mean, it looks like it's like up and to the left.
Yeah.
Yeah. I'd say we treat for the left.
Okay.
Yeah. Your eye movements are looking like the crystals they're there on the left, so.
Oh, really? Okay.
Yeah. We'll just,
So when you do the Epley, where would your final position be for the left?
Final position in terms of eye movements?
No, like, when you did, if I did it at home, I did it this morning, and I ended up on the right side.
Oh, I would say you go down to your left, head here for 30, head here for 30, and then you roll over and then sit up.
On the right side?
Yeah.
Okay. Well, yesterday I did the right
Theoretically, be facing right, yes, but yeah.
Yeah.
That should be right.
Okay.
All right. See you in a bit.
Okay, thanks.
Yep.
Alrighty, so I'll put that cover on, but you
Yeah.
can keep your eyes open and closed, whatever is most comfortable.
Yeah.
And it's going to be those backwards rotations that I'm sure you remember.
Slightly nauseous.
Yeah. Do you need a break before we start?
Not at all. No.
So just turning you to the left here. Okay, and then from this angle, you're going over that left shoulder 360 backwards, okay? We're going for the first rotation here in 3, 2, 1. All right. How you doing after that one?
Doing okay.
Okay, ready for the second?
Sure.
3, 2, 1. Double check that footage. Doc or Evan, mark improvement on the chair. I have a residual downbeat. I'd say I didn't mark the resolution. Just looks like a downbeat now.
60 cause, obviously.
Yeah.
Alright, we'll call resolution.
Okay.
We'll get him in the room for Doc.
How do we do? Fast?
Yeah, looks like we got pretty much all of it here. Just kind of checking with our PA to make sure that he agrees. So we'll get you out of here. So, and we're gonna find a room for you for the appointment as well. In the meantime, the post-treatment protocols for after doing those flips. For the next 10 to 14 days, we kind of want you to avoid any large head sweeping motions that could re-knock any of those crystals that we treated here today loose.
Okay.
So we want you to kind of, like you've got a cup of water on your head, avoid kind of looking down at the floor and looking too far up anymore, okay?
So no pickleball tonight?
Yeah, probably no pickleball probably is good.
Shit,
yeah.
Tomorrow? No?
For the next week or
Really?
2 weeks, yeah. Just so that we get them time to really settle, so that way we can kind of have the best chance of making sure that they stay or they don't kind of fall back out of place, if you will. Okay? So, yeah, just kind of keeping a level head essentially the whole time. No, typically if you drop something on the floor, you're going to kind of, instead of, squat instead of looking at it, looking at the ground, kind of have to look at it forward in your peripheral. And then while you're sleeping, avoid sleeping on that left side as much as you can. And then try to sleep more elevated. So instead of just typical one pillow, maybe using 2 or 3, whatever you can, to kind of get maybe a 30 to 45 degree angle. Okay, that's kind of, so essentially, yeah, just more elevated.
Okay, that was the Friday the 13th ride on the Omniax chair. How fun was that? How fun was that? Okay, here at Dr. Purcell's office, just went through consultation with him, had a great follow-up. Haven't seen him since 21. But the good news is Forks is still here, along with, in good company with 2 Triumph motorcycles. And of course, some legendary photos of Steve McQueen, the legend. That's the Dizzy Doctor, Dr. Purcell, here, Southern California, San Diego. Just did the amazing ride in the Epley chair. What'd you think of that? Let's go.